The Vice President, Professor Nana Jane Opoku-Agyeman, has called for an urgent reforms to address Africa's growing challenge of retaining trained health professionals, warning that the continent risks undermining years of investment in its health workforce if retention issues are not resolved. Speaking at the second African Health Workforce Investment Forum in Accra, the Vice President raised a central concern shaping discussions at the gathering: why African countries are able to train significant numbers of health workers but struggle to keep them within their health systems. The forum brought together policymakers, health experts, development partners, and labor stakeholders to discuss strategies for strengthening Africa's health workforce and improving service delivery across the continent. The Vice President's remarks come amid growing concern over the migration of African health professionals to developed countries where better working conditions and remuneration continue to attract critical staff away from domestic systems. She urged stakeholders at the forum to prioritize practical solutions that ensure trained professionals are not only produced in sufficient numbers but also retained and supported to deliver quality health care within their home countries.
Over the last 2 decades, life expectancy in the WHO African region has risen significantly. Service coverage has also improved steadily. This has been supported by expanded immunization, stronger disease control, maternal and child health interventions, and strengthening health systems. Yet, while progress has been real, universal health coverage remains beyond the reach of billions of Africans. And distance, cost, and access remain real challenges. This is why the Accra Reset Agenda remains so important. It calls for rethinking institutions, policies, and investments to restore confidence in public systems, boost national development, and place citizens at the center of governance. In health, this means building resilient, efficient, equitable, and accountable systems and true African health sovereignty. Sovereignty in health refers to our capacity to define our own health priorities, mobilize sustainable domestic financing, train health workers we need, retain our talent, strengthen our institutions, and organize services around our own defined realities.
The minister highlighted ongoing reforms within Ghana's health sector, including the implementation of the Free Primary Healthcare Initiative, expansion of health infrastructure, as well as efforts to recruit and retain health professionals across the country.
The Ministry of Health, working with partners, is advancing structured workforce exchange program. These programs are intended to promote ethical, regular, and mutually beneficial labor mobility, protect the needs of Ghana's health system, and create organized opportunities for young Ghanaian health professionals to gain international experience, enhance their skills, and return value to the domestic health system. Second, we have used the health labor market analysis to develop a draft national health workforce development plan. This plan positions health workforce investment as a national development priority and not merely as health sector staffing matter. For that reason, we are working closely with the Ministry of Finance, the National Development Planning Commission, and other stakeholders to integrate the plan into Ghana's medium-term development agenda. While these planning processes are important, health needs are immediate and cannot wait for perfect conditions. We have therefore begun implementing key elements of the national consensus even as the broader investment plan is being finalized. The Ministry of Health has introduced measures to improve the deployment and distribution of health workers to underserved regions and communities, while strengthening the use of evidence to guide postings, staffing norms, and service delivery priorities.